I know there's patients harmed in the system every day, and my son was one of those harmed. He died as a result.
Within the space of a few years, I lost 7 family members.
I personally had an incident of harm. My son died in hospital following elective surgery. So he was a healthy 15-year-old boy and died from failure to rescue in hospital.
I went in for a surgery. I woke up just as the surgeon was asking for the scalpel, and I was paralyzed. And so I remained paralyzed but fully conscious for the rest of the surgery.
In 2002, my daughter Martha died of an adverse drug reaction that initially wasn't reported. There was no learning that went on. There were no changes that occurred in the system. When we lost a child, there was so much community support and love. But from within the medical community, the silence was deafening. To know that your child has been harmed and has died, and that you're not helping to make it safe for other people and other people's children is just unbearable. Those in the medical profession are among the most educated and bright people we have in this country. They learn all the time. They're capable and willing to learn from previous mistakes. And I think these people who've been harmed are like our unsung heroes. They've suffered the ultimate price, and we need to honor them by learning from that and helping prevent it from happening to others. Patient harm experiences are the 3rd leading cause of death in this country.
When you look back at what the Canadian Patient Safety Institute's been able to accomplish and achieve over the past 17 years, the milestones tell the story. Within each one of those, whether it's a publication, a program, a product, a service, an event, they took hours and hours of work to achieve, but bringing the people together in order to impact that change has been astronomical. You almost need to look back and reflect on the journey in order to feel the sense of accomplishment and pride.
About 2001, the Royal College got very concerned, and Bernie Langer, who was the chief of surgery at the University of Toronto, but then president of the Royal College of Physicians and Surgeons of Canada, called and he said, we've got to do something. The Americans have come out with "To Err is Human." They were showing that 98,000 people a year died from adverse events in the US, and we thought it might be similar in Canada. So we formed the National Steering Committee, which I chaired. So with that in mind then, the idea was we would form 5 groups. So those 5 committees were attached to the National Steering Committee, which I chaired, and there were about 8 of us on there. Each of the members of that committee co-chaired one of the other groups. So we had actually hundreds of people across the country voluntarily looking at those issues.
I was honored to be asked by the Canadian Nurses Association to be the nursing representative, so to speak, on the Steering Committee for Patient Safety, the National Steering Committee for Patient Safety. And we got together and said, what are we going to do about patient safety for Canada? What kind of map do we need to create? How can Canada move ahead in this important issue that we're now paying attention to? So we developed a paper called Building a Safer System, which was published, I believe, in 2002.
It had 19 recommendations, and by my count, 16 of the 19 recommendations have been fully implemented. And the other 3 or 4 are well on their way. And of course, the first recommendation in the report was to create the Canadian Patient Safety Institute, which was announced in December of 2003.
We created an organization that developed credibility and was trusted by those with whom they worked and by Canadians. And you always wonder when you start something, is it flavor of the day? Is it going to get roots? Is it going to get traction? Is it going to be a valued partner? What may it evolve to be? And indeed, it became what we hoped. I mean, we really didn't know. But you hope you can create an organization that's strong, that has a reputation, that's a valued partner, and indeed that is what happened.
The Canadian Patient Safety Institute was established off the Sentinel document, Building a Safer System, and that really grounded us in our mandate and what we had to do and set forward recommendations that we had to achieve. There was a gap in the system, so we had 2 immediate tasks, I would say. Awareness building that patient safety is even an issue and that it exists. And then with that, filling the gap with tools, resources, programs, services in order to get rid of that risk.
Why CPSI and why a national effort? Well, Canada has what David Naylor calls this chronic condition. It's called NIH syndrome, and that doesn't stand for National Institutes of Health. It stands for Not Invented Here syndrome. This idea that we're the sum of our parts, not the greater than the sum of our parts. So CPSI was born out of this recognition that we needed to learn from one another. We owed it to patients in Canada, across Canada, to not repeat the same lessons at their expense.
I think the important thing about CPSI is it came into an environment where there had really been very little knowledge and very little experience of patient safety. And then with Peter Norton and a group of other colleagues, we published the Canadian Adverse Events Study in 2004. And all of a sudden people discovered that 1 in 13 patients in Canadian hospitals was unintentionally harmed as a result of a patient safety event. And there was a lot of anxiety, there was a lot of interest, and there was a lot of need to do something about that. And in December 2004, the Institute of Healthcare Improvement in the United States launched an initiative they called 100,000 Lives. They had identified a small number of events that happened in hospitals that had large-scale harm, where the evidence existed to reduce those events to 0 or close to 0 if that evidence was followed rigorously across hospitals. And the same events occurred in Canadian hospitals, and so this was just at the launch of the Canadian Patient Safety Institute. From leaders to frontline staff, everybody saw the need for this. They understood what had to be done, and they worked hard to make it happen. And over a number of years, we launched teams and initiatives across the country in different types of care environments, different types of patient safety initiatives to really make a difference. And so that put CPSI on the map, I think, more than anything else that they did in the first 5 years.
What in part sparked the need for a CPSI, or indeed the Wade panel, was the fact that, and I'm quoting here from the U.S. report, which basically said there's the equivalent of a 747 a day dying due to avoidable patient adverse events. And so the challenges were huge, remain significant, but I guess that was the driving force, is the recognition that we had to do better.
You know, the number of people harmed on an annual basis, the number of fatalities on an annual basis, is just devastating. When we released that information, we thought that the media would jump all over it, and not necessarily CPSI for maybe not doing our job, but the healthcare providers, the healthcare system. We thought that there was going to be this tsunami of controversy, and how could we say such things, and how could you report such statistics? It was quiet. It was too quiet.
When we released numbers around unintended healthcare harm being the third leading cause of death in Canada, people didn't pay attention. They still didn't pay attention. We get so focused on the numbers not being perfect, but the numbers are what they are. There's people's lives behind every one of those numbers. When we say every 13 minutes and 14 seconds, somebody in a Canadian hospital or receiving home care services dies as a result of unintended healthcare harm, those are people.
My mother had 2 hospitalizations, and during both of those hospitalizations, there were a series of adverse events that occurred. As a family member watching it happen, it was very disturbing. She came into Calgary from a holiday, and she had endocarditis, and she needed to have cardiac surgery. The surgery was an extended surgery, and the next day she bled out. They were able to bring her back from that. She had secondary surgery, but her kidneys didn't start. And after about 4 days, they put her on dialysis. And then the next day, she coded. And my sisters were bedside, and she had a blood level of potassium of 9.8. And we later found out that the dialysate she was receiving as a result of her kidneys not starting up after the surgery and after her code was made of potassium dialysate instead of sodium dialysate. And she passed away as a result of that. We later learned that another patient 5 days earlier had also died of the same mistake.
I would say 2 of the most pivotal moments that Canadian Patient Safety Institute has had in this country has been the publication of national guidelines for disclosure and the National Safer Healthcare Now campaign. So disclosure is really about providing an accurate understanding to patients, to families, to caregivers when harm occurs in their care.
When I started teaching disclosure, 15 years ago, formally as a patient safety manager, our conversation was around convincing people that they should disclose and why they ought to and all the reasons why they should. We don't have to have that conversation anymore. We're not convincing people to do it. We're convincing people that there's a way to do it well and to share some advice and experience. So that's a huge change from trying to protect a story to ensuring the patient or family gets that most accurate understanding of the care they received.
So those guidelines really outlined what the aims are of an effective conversation, but also how do you do it? And how do we ensure that people really know what happened in their care and get that apology? And then also, how do we then advance care so that it doesn't happen again? And those guidelines really form the foundation for policies, for approaches across this entire country, and sort of level set so that we all could ensure that Canadians have that experience when harm occurs. Safer Healthcare Now, which is the other big pivotal thing that I think CPSI did, they became sort of the backbone organization for this campaign, which brought together provincial quality councils, brought together national organizations to work collaboratively to support patient safety.
They were just born. They're an infant organization, 2 years old, and they needed to make a mark, and they needed to show health organizations that they added value. And this was the perfect opportunity because a large Canadian adverse event study had just come out to show that lots of people are being harmed in hospitals. Even though we have the best of intentions, there's lots of harm and death. And so we used that study to catapult us into this campaign to start talking about how can we make hospitals safer.
We launched it in 2005. It really involved multiple organizations across the entire province from one coast to the other, working collaboratively together along specific patient safety themes, and I think really contributed to this idea of how to work together, but also how organizations could help patient outcomes for over several years.
So Safer Healthcare Now was about bringing the clinical interventions to frontline providers and clinicians. So it was the idea of bringing evidence-informed practice to providers and reducing that amount of time, that gap between what the evidence says and actually the time it takes to actually do the initiative. And so we were doing quality improvement initiatives around clinical interventions. So initiatives such as infection prevention control, medication safety, falls prevention, hand hygiene is another one of our campaigns that we ran as well.
From the Safer Healthcare Now perspective, that set of bundles, consistent with, to some degree, with what was happening in the States with our 100,000 Lives campaign, again, was a Canadian approach to looking at how we take this bundled care and put it in place in the Canadian healthcare system. So Canadian context, Canadian leaders, Canadian champions, and helped us build this community across. For me, that was the start of building a community across the country with around patient safety.
And it was the first real time that we had done quality improvement and patient safety in this country. And what it led to, I think, is a huge legacy around an infrastructure to advance safety and quality improvement in this country.
The other important thing was it changed the attitude of those of us who worked within the healthcare system, who managed and administered within the system, and in patients. CPSI was very active in having patients represented on the boards and committees, but also patients had to really accept and take some responsibility for their own safety and for the safety of the people that they love.
I was diagnosed with postpartum depression, and when I also was diagnosed with that, they also diagnosed me with bipolar 1. And I went through a series of doctors. I was put in mental health wards many times. I went through years and years of biweekly shock treatment and on being overprescribed multiple amounts of psychiatric medication. I lost everything I had. I ended up living on the streets under a bridge downtown Calgary called Reconciliation Bridge. So one day I was sitting under the bridge and I thought, I might as well kill myself because I'm not living. I'm not getting any help. I'm not living. Why continue? So I sat there and something gave me the strength to live. I felt very unheard. I would go in and I'd have all this weird stuff happening and I didn't feel I was listened to at all. Every time I would go and see the doctor, oh, well, let's give you more medication. Let's give you more medication. And I found out years later, after conferring with doctors, I don't even have bipolar. I never had it. They say I had PTSD because I was so traumatized when I was young, and I carried that intergenerational trauma as a result of being an Indigenous person and what our generations have gone through.
A huge movement in patient safety over the last 18 years. I think if you said patient safety 18 years ago, you wouldn't get a common understanding of it. People would have thought you didn't need to spend any time on it because it was motherhood and apple pie, and it just happened naturally through the commitment of people who were providing care. And yet we knew that that was not the case. So I think the initial stages was the recognition that we weren't where we wanted to be, and then a real effort to actually have that translate into practice for patients.
So the Canadian Patient Safety Institute has been a national institute working towards patient safety. And one of the areas that they have, one of the programs they have, is the Patients for Patient Safety program. That's a collaboration with the World Health Organization.
We're a group of about 70 volunteers, most of whom have experienced harm in the healthcare system. A small group of us formed way back in 2006 after experiencing harm, thinking that we needed to do something to try and improve patient safety in Canada.
So we, as part of that program, help build tools for patients and public to know how to communicate effectively during their medical care, how to understand what's happening to them, And some of those tools are used nationally now, some are used internationally, and I think it's a clear example of how important it is to include the patient perspective and those patient stakeholders in every area of the healthcare system.
One of the biggest movements, I think, is actually having patients be part of our team. We would have thought, of course they are part of our team, and yet they were not. We always thought we were doing the best thing for them as opposed to the best thing with them.
Clearly, we have to understand these things from the patient's perspective. Patient safety is about the patient. And suddenly gave permission to staff to understand that they could engage the patients. They could engage the patients into this kind of effort. And when they did, they found out that they learned a lot.
I think one of the proudest moments and proudest accomplishments of our organization is really walking the talk around patient partnership and patient engagement. Being able to enable Patients for Patient Safety Canada, people with lived experience of healthcare harm, to be able to champion the patient voice and really drive home that message that we have a moral and ethical imperative to improve healthcare, because it affects all of us.
The voices of patients and families have been critical to all of this, and I think it's one of the rubs that we still have is how can we go forward with CPSI in the long run and strengthen the engagement, the voice of patients and families in the actual design of our systems.
I think what we've done is we've taken the ego out of the room and we brought the patient voice into the room, and we've been able to look in the eyes of whether it's a mother, a daughter, a loved one, or even that person that's been harmed, and we've been able to say to them, your harm wasn't without impact. We've taken what you've gone through and we've propelled it into system-wide change, and for that we're grateful.
So bringing in, really supporting and launching Patients for Patient Safety Canada and making it a requirement to have a patient sitting at the table when you're planning a new initiative, I think was probably the most important thing that they've done.
Patients are the people who are served by the healthcare system. And so if you don't know what they're thinking, what they need, what they're experiencing, you can't be successful in what you're delivering. And so it's extremely important that the patient voice is integral. Today, there are one or more patients involved in every single committee and program that CPSI runs. And they've become a model for not only the country, in terms of other pan-Canadian health organizations, in terms of partnering with patients, but the World Health Organization has actually suggested that other countries should emulate the model that we have here between CPSI and Patients for Patient Safety Canada.
The most significant accomplishment for CPSI, from my perspective, is actually spending time and energy on listening to the voices of the patients, or as I call it, the customers. So it's the patients for patient safety, it's the healthcare workers delivering patient safety, it's the public who demand patient safety. So when we put customers or patients or families, healthcare workers in the center of everything we do, that really speaks to what patient safety is all about, and CPSI has done that beautifully.
The issue, I think, was listening to people who we are serving. So the cultural change is actually awareness, wanting to listen, and shifting from this is all about me, happens to be a doctor doing something, to you as a patient for whom I am doing something, for I'm offering something that's relevant to you, that's respectful of you, and is appropriate for whatever your medical need is. That's the cultural change.
The issue of culture is always a very complex issue and must be done at the local level. when you walk into an organization, it has a culture. So to change the culture means that you have to give them something that would benefit them and benefit the patient and benefit the staff. And I think eventually people began to figure that out. And so I think they engaged the staff, they engaged the patients. As we did nationally, they began doing it locally.
It takes a long time to influence culture. The literature would say, perhaps a decade or even more. And what is one of the challenges, many people have been trained in a certain way and are used to and comfortable in doing things that way over many years. And so to change that is really hard work, and it takes the involvement of a lot of people. And I think that's what CPSI has done well, engaging leaders at the very senior level, both in government and in health providing organizations, but more importantly, actually being accessible and relevant to people delivering the care at the point of care.
I think organizationally we've seen major changes in the culture that surrounds and supports healthcare. And what are the examples? The examples are that we build a system of healthcare now around the people who are served and the people who are providing care, because they're our true asset, and they will be the judges of the success of our healthcare system. Engaging patients has made a major difference in how we listen and hear about the health system.
Probably one of the biggest things I've learned is the power of story. To just listen to what individuals have to say to you. When we listen to patients who've been involved in harm, unintended harm from the healthcare system, when we listen to providers, those who are providing care, who have unintentionally harmed people, it is so powerful, and we learn so much, and it really helps guide us to what we need to do to improve patient safety.
To be able to spend time with people who have lost a loved one due to harm in healthcare, or they themselves have been harmed, it immediately reminds you why we do the work that we do. And to be able to be exposed to the vulnerability, the courage, and the hope that each of those members of Patients for Patient Safety Canada shared with me will be something that I'll take with me for the rest of my career.
Patient stories are actually the fundamental, the groundwork that you have to be able to tell them. Even when they're challenging, even when they're tragic, you have to be able to talk about them.
When they tell their story to politicians, when they tell their story to people who are working in health departments across this country, it touches their heart. It's not just, something they're reading, or it's not just data or information. This is real. So it's so, so powerful, and it's become such a major part of what we do at CPSI.
My story of harm comprises a series of events, a series of happenings that in total set a process in motion that had me experience what may have been an unnecessary hysterectomy at 29, followed by, at 35, bowel suspension. And when I turned 45, I had a colostomy. And at 70, I now live with complications of that colostomy. Each of these events were a cascade of happenings because of failure to diagnose me in a timely fashion, a failure to recognize what in fact was going on, a fragmentation of my healthcare. I had 4 specialists at the age of 20. In and of themselves, each of these were harm events, but it was the total of this sequence of events that really has caused me to reflect on my experience as an example of the kinds of things that can occur. People may be more readily familiar with the kind of catastrophic events that result in loss of life, loss of limb, loss of health. But there are many, many different types of harm events that occur. And we currently really don't have a good measure of the total picture of harm in Canada.
Up until, say, 2012, 2013, we had a lot of success regionally, locally. Some initiatives through Safer Healthcare Now had a national spread, but we didn't really have a national strategy. And that strategy was missing a collaboration of key influencers from across the country. And so we began talking about the creation of a consortium, a national consortium, to drive a national patient safety agenda. And that work began in 2013. And it's probably what I'm most proud of, because really what it did, it brought together all the hard work that started from the beginning of the organization. It built on all the relationships that had been created. It capitalized and leveraged the expertise of the CPSI staff and the delivery system and the other organizations. And collectively, there was a commitment to improve the patient safety landscape.
I think the biggest piece is how they have contributed to bringing, CPSI has contributed to bringing the standard of knowledge up to a high level across the entirety of the country. So whether that means frontline providers or boards or executive leadership, that commitment to and common understanding of the importance of patient safety and is one. I think followed closely as a second is the collaborative effort. So particularly in the last 5 years around having a national presence and a national understanding of what it means to have a multitude of agencies come together in order to contribute to patient safety. I think those are huge accomplishments.
Without question, patient safety is a complex challenge. And with complex challenges, you almost have to hit it at multiple different levels. And for us, I think at the Canadian Patient Safety Institute, we quickly realized with our toolkit for effective governance, you need to get boards on board. You need to get leadership on board. You can't exist unless you have a patient voice at the table. And then with that perfect mix or magic making, you can drive the change.
So I would say one of the most significant contributions, and there's so many that have happened, but one of the ones that really sticks out for me is we had the privilege to develop a new strategic plan for CPSI. And we knew that what CPSI had been doing over the last number of years was amazing work, but it wasn't getting us far enough. It wasn't raising the bar on patient safety. So we took a bold new direction. And we decided that we needed to continue to do some of the things we were doing, but also branch out and to do some different things. And so one of the things that we did is we branched out and we went public. Our work before had been primarily with care providers within the healthcare system, but we thought, you know what, we need to do more than that. So we reached out to patients, we'd always worked with patients, but this time broader, to the public, to really awaken them to what this state of patient safety was in this country. We reached out to policymakers, to regulators, to politicians, so in a very different way. For me, that was a significant contribution and something that I think will set patient safety in really great stead as we move forward on our journey.
So one of the things I'm most proud of is some of the current work we are doing with CPSI around the measurement and monitoring for safety framework. As someone who's been working in the patient safety field for years, formally for the last 16, we struggled to have this conversation about what patient safety was and what it wasn't. And we liken it always to the idea that health is more than the absence of illness, so safety has to be more than the absence of harm. But the data we had easy access to was all harm data. And so what we were able to do by participating in the most recent MMSF work, Measurement and Monitoring for Safety Framework work, with CPSI is we're able to do two things. One is we redesigned the whole way we describe safety up to the board through our senior executive, using the dimensions in the MMSF, which is more than just past harm. And we also then took that same model and had local teams using it in the operating room or even in our concerns management work. And the reason I'm proud of it is it allows us to start bringing the patient voice, the narrative, the storytelling that we've all been talking about for so long as being critically important to understanding quality, and it gives us almost a permission to stand and tell it.
What measurement and monitoring of safety did, we introduced it at the bedside with a core team of frontline worker, middle manager like a head nurse, a physician, and a senior leader. And those 4 people would come, learn the concepts of measurement and monitoring of safety and take it back. Once we told them and convinced them not to rush this, and they became familiar with how to implement the conceptual model of measurement and monitoring, it changed the way the staff took responsibility.
We've been really working with providers around shifting our thinking around patient safety. So this understanding that patient safety is more than just the prevention of harm, but it's really around the creation of safety, and that we can actually do a lot as a collective group to create safety, which is a slightly different angle and approach than always working at preventing specific types of harm. And we've learned through our work with frontline providers and healthcare organizations that you can create a culture of safety, that you can create safety and shift that needle, and you can provide that platform and that willingness where people want to go to work and do their work differently around creating safety.
Thousands of people have joined this movement. People who've been involved in harm in one way, shape, or another. Those who are just really interested in making care safer. These are our partners. We could not do this work without them. They are essential to the whole movement of patient safety and getting care the safest it can be in this country.
When we think about some of the milestones, they might seem like, releasing a report or releasing research, or perhaps it was hosting an event. But those all have trickle effects. Those have been seeds that were planted that had inspired other people to take away what they learned, what they saw, what they could apply back in their context. And that's the true impact of the organization.
When I look back to 20 years ago to today, been magnificent changes that have occurred. And I think CPSI has been responsible for many of those changes.
We have moved a tremendous amount over the last 18 years. There wouldn't be a healthcare organization that doesn't have a quality and safety arm. People are looking at this all of the time. Everybody's trying really hard. But despite that, every 13 minutes and 14 seconds, somebody dies in our healthcare system from unintended harm, despite all the work that we've done over this time. So we know that many parts of our healthcare system have improved considerably over this time span, but we still know there's a lot of work to be done, and we can only achieve this together.
So when I look forward in the vision of the art of the possible, I would like to see 2 things. And I'm first thinking about it in a very personal way. I would want me and my loved ones to feel safe, to be confident that when we receive care, it's the best possible care, evidence-informed and provided by people that are supported in being able to deliver that safe care. So I think it really has to do with helping the public not only receive safe care, but be confident in that care. And that will only happen if the care team is provided with the tools, the equipment, the training that they need to provide the safest care that's possible in the entire world.
My vision for patient safety into the future is really this idea of harnessing the wisdom of patients and families and matching that with the willingness of healthcare providers to create safe care. So together in a really genuine format of working on a day-to-day, moment-to-moment basis of creating safety. So really tapping into what you're hearing, what you're seeing, what you're feeling, and making change on the moment, on the fly around this idea of creating safety.
CPSI has absolutely put patient safety on the map. It was not on people's radars 17 years ago. And the health system is better off for it and is an essential part of the landscape in Canada. We need to have an organization that keeps it at the forefront, that talks to our policymakers, hospital leads, healthcare system organizations. It's an essential piece that people are speaking up for patients.
I am retired. I am a husband. I am a father. I am a grandfather. I am a brother. And I am also a patient of the healthcare system. So I care. I care about where we're at today, but I really care about where we should be tomorrow.
The amalgamation with the Canadian Foundation for Healthcare Improvement, to me, is absolutely the natural next step. We are two very small organizations. There have been 3 federal reports. All 3 of them said we shouldn't be standalone. Work is hugely important, but too small to really make an impact in the kind of way that we should. I know that with the combined strength of these 2 organizations and combined resources, we can be so much better. The impact can be so much greater than we can alone.
I just see it as a natural evolution. These 2 organizations were started separate and apart, but share a mission all around patient safety and patient-centered policy. So I'm very excited about it, and I think this is exactly what's required to take the patient safety advocacy agenda to the next level.
I think this is the perfect opportunity for CPSI, and I'm delighted actually that they're merging and becoming a larger organization with more partners, more collaboration, and so on. Because I think it models for the world that integration is possible and that an integrated approach to quality and patient safety is an imperative for our system.
Quality improvement is not a point in place. Rather, it's a place we will continue to grow and keep on going to. And through that transition, patient safety, quality improvement will deliver on the utmost healthcare delivery for our country and hopefully internationally as well.
You look at the pan-Canadian healthcare organizations and you look at the mandate of the Canadian Patient Safety Institute and the mandate of the Canadian Foundation for Healthcare Improvement, and the logical next step was to bring these 2 organizations together to be a force to be reckoned with. And CPSI on its own, we were trying so hard, but with $8 million a year and $1 billion industry, we needed to compile resources in order to increase our impact. And we're really excited to see what the next 5-10 years bring for this new organization.
Our imprint, the CPSI imprint, is not a single imprint from a single board member, a CEO, or a single director. Our imprint is thousands of handprints on the patient safety landscape in Canada. I would hope in the future the combined organization will be 1,000 fingerprints of the staff of CPSI, the staff of the existing organization, and whatever comes next.
17 years of CPSI, leading, enabling, facilitating, educating, and playing a diverse set of roles in Canada to enable the improvement, to affect the improvement of safety in healthcare. I think since then, because of how CPSI has done its work, it has grown into something much larger and a much larger asset to Canadians, to patients, to healthcare in general.
I can say that we have a safer system. And I can say that as a result of Mom's passing, things changed. And people have come up to me and said, my loved one was saved because of the program that came out of your mom's death. So, it's very validating that specific changes have been made. So we're much safer in many ways.
I'm hoping that with a larger organization, a bigger budget, we can have more of a national voice, that we can reach Canadians and we can really start to make a cultural shift towards safety.
This organization has done so much for me. It's given me a sense of power when I felt powerless. It's given me a voice when I felt voiceless. It's given me an opportunity to do some good work. From the horrific past that I went through, I can now help change lives. There's nothing better than that.
For this new organization, here's my parting advice. Be bold, be brave, be courageous. Please color outside the lines. Don't do just what you think you should be doing. Go way beyond that. Don't ask permission, beg forgiveness. These are the things. We have an opportunity to be innovative, to be creative, to set the bar, to lead the world in quality and safety. Bad on us if we don't do it. So be bold, people, be bold.